Hi, my name is Dustyn Walton, and my poster is Muscular Imbalances Caused by Grip Variations During Deadlift Exercise. This is a research proposal. So, following graduation, I will be going into the Master of Science in Athletic Training, Doctor of Physical Therapy dual degree program. And injury prevention is one thing that I really want to focus on. And so, having this curiosity for knowledge, I decided to look at muscular imbalances in the deadlift, with a lot of lower back pain being prevalent in those who perform the deadlift. And previous research has shown that muscular imbalances have been correlated with chronic low back pain in a population with an age range of 17 to 46 years old. So, with that encompassing a large population, I decided to look at these possible imbalances with the deadlift and see if this could be causing any of the low back pain in deadlift performers. So there are three main grip variations in the deadlift, with the double pronated grip seen in figure A, or part A of figure 1, the right hand supinated mixed grip, and then the left hand supinated mixed grip. These were the three variations that will be analyzed in this research, and how these affect the imbalances in the lower limb and also the lower back. Previous research has looked at force imbalances between the right and left leg using these grip variations, but there appears to be a gap in research that hasn't looked at muscular activity while performing this deadlift. So the purpose of this study was to evaluate the muscle activity and identify any possible imbalances with the grip variations. There are two main hypotheses for this study, with the first hypothesis being that there will be no significant muscle activity imbalances between the right and left leg with any of the grip variations, and that hypothesis two is there will be a significant muscle activity imbalance in the lower back with both mixed grip variations, with the higher muscle activity being on the same side as the supinated hand for both the right hand supinated and left hand supinated mixed grips. So for the participant recruitment, ideally there would be 50 participants recruited with at least a training age of 5 years, meaning that they have trained consistently for 5 years and have experience performing the conventional deadlift. There will be 8 EMG sensors placed bilaterally on the vastus lateralis, vastus medialis, biceps femoris, and erector spinae muscles. And then following data collection, the data will be analyzed using the Delsey's EMG Works acquisition software. The experiment procedure, there will be a warm-up of 10 reps with reps being performed at 50%, 60%, and 70% of the 1 rep maximum as reported by participants. Following the warm-up, we will measure the maximum voluntary contraction for the quadriceps, hamstrings, and low back muscle groups. The maximum voluntary contraction is the amount of muscle activity that the participant can maximally contract against a load that they cannot move, to measure their maximum contraction for that muscle group. Following the MVC measurement, we will perform the testing procedure, which is based on previous research, and loads will be at 80% of the reported 1 rep maximum, with a total of 6 reps performed with 2 reps of each grip variation and 5 minutes rest between each of the grips, which will be performed in a random order as assigned by the experimenter. So based on the hypotheses, it is expected that no significant muscle activity will be seen in the muscles of the lower limbs during any of the conditions, and then there will be a significant muscle activity imbalance in the muscles of the erector spinae, with the higher muscular activity being seen on the same side as the supinated hand. So this research would expand on previous research which looked at force imbalances, but it would provide further information as to any possible causes to muscular imbalances and low back pain seen in those who perform the deadlift. And so this research could provide possible explanations as to why muscular imbalances are seen and help to prevent any possible imbalances in those and prevent low back pain caused by variations in deadlift grip.